My name is Jessica Quinton,
And I'm Abigail Kopke.
and we chose Virginia Henderson as our nurse leader. Okay, we chose Virginia Henderson because she is referred to as the First Lady of Nursing and the Florence Nightingale of the 21st century. Her work affected nursing communities not only nationally but internationally as well.
Okay, Virginia Henderson was born November 30th, 1897 in Kansas City, Missouri. She was actually named after, her mom actually named her after the state she wanted to move to. So in 1901, the family relocated to Virginia. She died March 19th, 1996, and her career lasted more than 60 years as a nurse, teacher, author, and researcher.
Okay, she wanted to become a nurse during World War I because she wanted to help the sick and injured people in the military. In 1918, she enrolled in the Army School of Nursing and graduated in 1921. She attended Columbia University to finish her bachelor and master degrees.
Okay. In 1921, she worked at the Henry Street Visiting Nurse Service, and she worked here for 2 years after graduation. She initially planned to switch professions after 2 years, but she had a strong desire to help the profession that had averted her plan. In 1924 to 1929, she worked in Norfolk Protestant Hospital as an instructor and educational director. In 1930, she went to Strong Memorial Hospital in Rochester, New York to work as a nurse supervisor and clinical instructor at an outpatient department. From 1934 to 1948, she worked at Teachers College at Columbia University in New York as an instructor and associate professor. And then from 1953 to the end of her career, she worked at Yale University School of Nursing as a research associate. And in 1971 to 1996, she became a research associate with Emeritus.
Okay, while she was a professor teaching, she worked with Harmer to revise the principles and practice of nursing. When the next edition was published in 1955, she introduced her now famous definition of nursing. And then we have a quote from her saying, "The unique function of the nurse is to assist the individual, sick or well, in the performance of those activities, contributing to health or its recovery, or to a peaceful death, that he would perform unaided if he had the necessary strength, will, or knowledge, and to do this in such a way to help him gain independence as rapidly as possible."
Some of the other publications by Henderson were the Nursing Studies Index Project, and this was conducted research from 1959 to 1971 for a Nursing Studies Index Project. The outcome of this project was the publication of Nurses Studies Index. This was the first annotated index of nursing research, and it's a 4-volume nursing book. Her basic principles of nursing care was started in 1960 and 1997. She had the nature of nursing in 1966 and the nature of nursing reflections after 21 years in 1991.
At the age of 75, she began to focus on international teaching and speaking. Virginia Henderson authored one of the most accurate definitions of nursing, promoted nursing research as the basis of nursing knowledge, advocated for humane and holistic care for patients internationally, and represented nursing with dignity, honor, and grace throughout her career, which spanned most of the 20th century. She won 12 honorary doctoral degrees and the International Council of Nurses' prestigious Christiana Ryman Prize, which is one of the most prestigious nursing awards.
Okay. Leadership qualities. Henderson developed her theory because she didn't think that the nurse's role was clear enough, and she wanted to ensure that the patient's safety and needs were met. Henderson's work is viewed as philosophy of the purpose and function of nursing. The work done by Henderson has been influential in developing a curriculum for nursing and clinical practice, as well as in promoting clinical research.
She has been referred to as the Florence Nightingale of the 20th century and also as the First Lady of Nursing. She elaborated on her definition of nursing by identifying 14 basic needs upon which nursing care is based. 8 of these needs pertain directly to bodily functions, while the other 6 relate to safety and finding meaning in life. The 14 basic needs make up what is now known as the need theory.
Okay, the 14 components of Virginia Henderson's need theory. Breathe normally, eat and drink adequately, eliminate body waste, move and maintain desirable postures, sleep and rest, select suitable clothes, dress and undress, maintain body temperature within normal range by adjusting clothing and modifying temperature, keep the body clean and well groomed and protect the integument, avoid dangers in the environment and avoid injuring others, communicate with others in expressing emotions, needs, fears, or opinions, worship according to one's faith, work in such a way that there is a sense of accomplishment, play or participate in various forms of recreation, and finally, learn, discover, or satisfy the curiosity that leads to normal development and health and use available health facilities.
While Henderson defined nursing in functional terms, she emphasized the art of nursing as well as empathetic understanding, stating that the nurse must get inside the skin of each of her patients in order to know what he needs. She believed that the beauty of nursing is the combination of your heart, your head, and your hands, and where you separate them, you diminish them. The nurse is and should be an independent practitioner and able to make independent judgments as long as he or she is not diagnosing, prescribing treatment for disease, or making a prognosis. For these are the physician's functions, but the nurse is viewed as the authority on basic nursing care.
Okay, the nursing need theory. The theory's main focus is increasing a patient's independence can help quicken their progress while in the hospital. There are four major concepts of the need theory: the individual, environment, health, and nursing. The emphasis is placed mainly on the basic human needs. The concept of the theory is widely accepted in nursing today. The theory and its 14 components are simple, logical, and able to be applied to patients of all ages.
Events that influenced the development of the need theory: when she was revising the textbook of the Principles and Practices of Nursing written by Bertha Harmer, Henderson found that there was not a clear definition about the role and function of a nurse. She was concerned that there were no provisions for licensure of nurses. She wanted to ensure that patients received safe and competent care by defining what makes a nurse. She did this by looking over nursing functions outlined by the ANA and found that the statements made were unclear.
Assumptions of the need theory were the mind and body are inseparable and are interrelated. The nurse has a unique function to help well or sick persons. The nurse functions as a member of the medical team, but functions independently of the physician. The patient's needs are covered by the 14 components of nursing. The nurse and patient are always working toward a goal, whether it be independence or peaceful death. Health promotion is an important goal of the nurse. Nurses should know about social customs and religious practices, and finally, professional practice is generated from research-based knowledge.
Okay, so some propositions about Henderson's definition and 14 components of care. She defined the nurse as a substitute for a patient, which means during times of need, the nurse is a substitute for what the patient lacks, which would be strength, will, and knowledge. The nurse as a helper to a patient, which the nurse would help a patient by assisting the patient to regain his or her independence. And the nurse is a partner with the patient. She's working as partners together to formulate a plan of care.
Okay, some student learning outcomes that we were able to link with the Virginia Henderson were Henderson's 14 basic needs incorporates the evolving social, cultural, and health care delivery trends. Using the need theory, the nurse collaborates with the patient and other healthcare team members to obtain outcomes that are based on current research and clinical expertise.
Another learning outcome that we were able to link was Henderson explains that the nurse is an independent fraction as long as he or she stays within their scope of practice. Using legal and ethical standards, a nurse provides care professionally and can be held accountable for the care that has been provided. And due to Henderson's questioning of the ANA standards for nursing, a clearer definition of nurses' functions were established. These new functions are implemented in patient care today.
In Henderson's need theory, she created 14 basic needs for the patient that help improve their quality of life. She advocated for a change in the nursing function and role outlined by the ANA because it was unclear what the nursing functions were.
And again, repeating what we said, for professional nursing practice, Virginia Henderson was known as the First Lady of Nursing. Her work is still in use today. As stated above, the work done by Henderson has been influential in developing a curriculum for nursing and clinical practice, as well as in promoting clinical research.